Halo, saya Ira. Hari ini saya bersama DrJared Ng dari Connections MindHealth di Novena. Hari ini kami akan membahas mengenai ADHD. Hi DrJared, thank you so much for spending time with us today. We want to ask you about ADHD.
Okay.
Yeah. Can you explain to us what is the ADHD and how it affects individuals?
Okay. Thanks, Ira, for having me. ADHD actually stands for Attention Deficit Hyperactivity Disorder. It is a neurodevelopmental disorder that can affect children and adults as well. It's characterized by symptoms of inattention, hyperactivity, as well as impulsivity, and it has to cause some dysfunction, impairment in their life. It arises from childhood, and adults can also get it. They may continue to present with some symptoms.
So it always starts from young?
Yes.
It doesn't suddenly happen in adults?
Yeah, it doesn't. Although in many cases that I've seen, I think what happens is that adults are more attuned to the symptoms, and then they raise their concern. I think I see many adults who tells me that long ago people are not so educated about this, and the parents never felt that this was a mental health or a medical disorder. They just attribute it to conditions like naughtiness or laziness. It's only when they're adults that they find out that actually they are suffering from ADHD.
So actually, how do you differentiate then between just a normal naughtiness or kids being active than ADHD? How do you differentiate that?
I think when we classify a patient, when we diagnose a patient with ADHD, they must fulfill a set of criteria, which we base it on the DSM. So they need to have a certain number of symptoms of inattention and or a certain number of symptoms of hyperactivity or impulsivity, and that's when we decide that whether or not they fulfill the criteria for ADHD. I think the other important thing is that when we look at a child, we don't just purely look at the symptoms, we also look at the level of impairment. And for ADHD to be diagnosed, there must be impairment in two different settings. Okay. Most of the time it's in a family setting as well as in a school setting. So whenever we diagnose ADHD, we don't just get an account from the parents or from the patient themselves. We also need to speak to the school teachers. Of course, we do this only with the patients and the family consent.
So what kind of impairment or the symptoms that you will this is ADHD?
So some of the symptoms, for example, symptoms of inattention will be difficulty paying attention. They may be very
How long is the attention span that?
No, I think it depends on the age group of the person.
Okay.
Developmentally, we need to look at the phase where the child is in before we decide. Wise to say that a child must be able to pay attention for 2.5 hours, for example. I think it really depends on what the child is doing. It depends on the child's age as well. Okay. So all this will need a lot of corroborative history from the parents, from the school, sometimes even from caregivers like grandparents or even tuition teachers. They will give us a better understanding.
So the impairment means they can't study at all, or?
It wouldn't just be in terms of academics. So academics certainly in a child's life is really important. We want to look at whether they even do their homework, whether they check their homework, whether they have difficulties handing in their homework. They may even forget that they have homework in the first place. We also look at exams. We also look at class tests as well. But beyond that, we want to see whether the symptoms have affected their family relationship, social relationship, as well as in school with other people. Sometimes the forgetfulness will even make them things like forgetting appointments, forgetting to bring things to school, forgetting to bring things home, and that can create quite a bit of problems. We also know that a lot of ADHD children, they are also very talkative. They talk in settings which they are not supposed to talk, like during class, when they go to a restaurant or when they watch a show. They have difficulties controlling that. And they may even keep on interrupting other people's conversation, and this actually irritates a lot of people around them. So for some of the ADHD children that we see, they actually have very few friends because they say that, my friends are very irritated by me. So these are some of the things that we see. So it's not just in terms of academics. We look at family relationships, social relationships as well.
I also know that there's some condition called ADD, Attention Deficit Disorder. So what's the difference between ADHD and ADD?
Okay, so when we talk about ADHD, there's actually three subtypes. So there's ADHD predominantly hyperactive. there's ADHD predominantly inattentive, and there's ADHD combined. So both hyperactive and inattentive symptoms. So ADD is a little bit of an outdated term, but ADD actually means the ADHD inattentive subtype.
Oh, I
Yeah,
see.
so this is how we
it's
differentiate.
actually the same,
Yes,
but then it's just
actually the same. But when we describe somebody with ADD, it just means that their main issue is with poor attention,
More
poor
the-
concentration.
I see.
They may not be so evidently hyperactive.
Dr. Jared, actually the symptoms that you mentioned just now, right, is very common.
Yes, it is. It is.
Yeah.
So this is pretty interesting because if you look at data in Singapore, it's estimated maybe 5% of children, even those without a family history, would have ADHD. If you look at data from other countries, it could be as high as 30%. Of course, we think that perhaps 5% is quite conservative and probably the real situation. If you think about a classroom setting in Singapore, in Asia, every class have about 40 kids. So 5% equals to 2. There's probably about 2 cases in every class with ADHD.
Which is quite a lot then.
It is quite a lot. But interestingly, we also know that ADHD is actually is inheritable. So a lot of times when we see children with ADHD, and then when you do a deeper dive into the parents' history, you will find that very similar symptoms may happen in the parents. Yeah, in fact, just a few days ago, I saw a patient. She came with her mother and her child. And the mother said, yeah, my daughter was exactly like that, just like my grandchild. So symptoms may have a reason, but it's just that at that time, it may not have been picked up. But I think you're right, that a lot of the symptoms that's discussed just now, like forgetting to bring things to
Yes.
school, not wanting to do homework, is certainly very consistent. A lot of people also don't want to do homework or they forget to bring things, but I think it's the degree. I have a patient with ADHD, she loses her water bottle 5 times in a month. I have another patient who loses the EasyLink card all the time until she gets punished. I have kids that the grades, the intelligence is there, they're very bright, but when you look at their homework, it's a lot of missed questions. Forget to do part A, forget to do the last question, and no matter how much you try to teach the child, they always have a difficulty.
So is it curable?
Being a neurodevelopmental disorder, I wouldn't say that we can cure it, but we can certainly use strategies to manage it. There's 2 main ways that we can deal with ADHD. One is through behavioral intervention. There's even classes where they can do classroom strategy, telling the student, the patient, how best to organize things, like keeping notes, how to keep records. We tell parents that parenting is really important. We tell parents that if they want to teach a child who may have ADHD, important to break the instruction into small parts rather than give them this really long lecture, because maybe after 5-10 minutes the child's attention is gone. Right? So parental skills is important.
So it's how you manage the child
Yes.
and help them cope with
The condition. Yeah.
yes.
But we know that in some cases it's very severe. So we do use medication. So generally there's 2 types of medication that we can use. One type is a stimulant and the other type is non-stimulant. Stimulants tend to be quite effective, but we always have to weigh a balance between side effects as well as the beneficial
So what's the
effect.
difference between these 2 group of medicine for them?
Okay, so for stimulant medication, typically the child or the patient, if it's, let's say it's an adult, right, the person only need to take the medication when they need to focus.
Okay.
And the medications are available in many different formulations. There's some that help the patient focus for 3 to 4 hours. There's some that help them focus for 6 hours, 10 hours. And one called Vyvanse was recently approved. Just last year in Singapore, it helps the patient focus for up to 13 hours. So for this particular group of medication, patients only need to take it when they need to focus. So if you think about it, maybe on school holidays, weekends, public holidays, the child don't need to take.
Okay.
But when we talk about non-stimulant medication, patients then need to take it every day to have that effect. And some of the kids may find it very troublesome. They may not want to take it.
Then when they don't take, they will just going to
Yes.
behave like
Their symptoms will recur.
as per normal.
Yeah, as per normal.
Wouldn't they be confused?
No, it's just that when the medication is in effect, they are able to focus. When the medication is not in effect, then their attention span will be like just how it has always been. I think I wanted to say that for children with ADHD, many of them do have some improvement in the symptoms as they reach adulthood. So when they turn 15, 16, a lot of the hyperactive behavior may actually subside. Of course, you know that for many of these kids, they may still be a little bit disorganized, forgetful, but by then they could find some way to cope. Yeah. But what's important is why we want to treat patients with ADHD is that we know the importance that academics play, not just in the person's future or career, but also in their own self-esteem. Imagine a child always doing badly in class because he or she has ADHD. They may be singled out by the teachers, they may be sent for remedial lessons, they may have got scolding or unfavorable reports in their report book. I think when a child sees this, they also be quite affected. So we do want to treat them and allow them to fulfill their potential. Many of the kids that I see are very intelligent. It's just that they have got ADHD that impairs their ability to learn properly.
So the impact of ADHD that we need to manage as well. Yeah?
That's right. So the impact is not just in terms of grade, I think in terms of social relationship.
Correct.
I have got this patient that I was seeing for ADHD. He's very impulsive. He's very hyperactive. He has got so much issues with the mom. They quarrel almost every day. That when his behavior started to get better, the relationship with the mom also improved. So I think we have to look beyond grades, beyond school results, but look at the wider aspects of their life. And another reason why we do want to treat ADHD is that there are many studies suggesting that when children have got ADHD, they have increased risk of developing things like alcohol dependence, they may have got unemployment, they may have got lower educational attainment compared to their peers without ADHD. So we do want to pick it up and treat early.
So what advice would you give parents to like understand, oh okay, this child needs help? Because the symptoms are very common and maybe as parents we also didn't notice. Yeah. Is there any advice that you can give?
I think it's always being open to feedback, not just by what they see at home, but also getting feedback from the school. I think right now in many schools, the teachers are all very attuned to behavioral issues in the children. If you think about it, parents nowadays, they just have 1 or 2 kids. But in a classroom setting when there's 40 children, the teachers can pick out who is having some problem.
They have some comparison.
Yeah, they have some comparison. Every school in Singapore also has got school counselor. I'm not sure about school elsewhere, but most schools have got school counselors that are trained. They will be able to pick up some of these cases as well. And when they give feedback to the family, I think family can take note of it. I know a lot of parents are very hesitant to have their child see a psychiatrist or see a mental health professional in case it affects them. But I think importantly is perhaps to consider the impact of not seeking help, because that's also quite significant as well. I think it's important to have a chat with a mental health professional to see whether anything is actually wrong. You're right, sometimes maybe after the assessment, I do have cases where I do an assessment and I tell the parents that actually there's no ADHD. And that the child may actually have got some learning disorder, and that's where we work very closely with psychologists and sometimes even occupational therapists as well to see whether there's any other condition that's affecting the child's learning.
So it's important to be open to seek, at least advice from the doctor whether the child really have ADHD or not in the first place.
That's right. A doctor, a psychologist, or a counselor. I believe in the no wrong door policy. That if you feel that somebody at home needs help, it's important to speak to somebody and they will refer to the right person accordingly.
Thank you so much, Dr. Jared, for the information.
Thank you.